just going to let the count rise, which is doing quickly. Right. So welcome everyone, and thank you again for a wonderful panel to accepting to participate in this, the second session of our Interlink webinar series. The Interlink webinar series is part of an initiative led by the International Network of Transport and Accessibility in Low-Income Communities. Interlink, it's Latin American arm, Interlink LAC, University of Manchester, UCL, and this particular session is coordinated between the Development Planning Unit of UCL and Walk 21 Network, which are represented by Jim Walker, who you can see on the screen, and myself, Daniel Oviedo. And with us, we have as well Karen Lucas, Director of the Interlink Network, and Emma Tsoneva, who is the coordinator of the network. We have, as I said, a great set of speakers for what promises to be an exciting discussions about this idea of inclusifying urban transport practice, planning, engineering, etc., all the practice related to transport planning and policy. And for that, we have Vicki Austin from the Global Disability Innovation Hub, who's going to be speaking about disability innovation in accessible transport. Then we have Luisa Rubio from the Secretariat of Mobility of Bogota, who is leading a program focused on walking and cycling to school for children in the capital of Colombia. And then we have Dr. Lorraine Darcy from TU Dublin, who's going to speak about more inclusive design for transport systems and streets with a focus on gender. So we will have the way that the webinar is going to run. We're going to have three around 15-minute presentations back to back. Then Jim is going to initiate the presentation with a prompt, with a wrap up from the presentations. You are all welcome, as our speakers are going through their slides, to use the Q&A function of the webinar to post your questions or put them on the chat. Myself, Karen, and Emma are going to keep an eye on those and bring them when we cover our different points of discussion. And then for those of you who haven't registered or haven't followed the full program, you can find it at the bottom, as you show on the slide, the interlink.org/events. You can find the rest of the webinar series. So without further ado, let's move on to our first speaker, Vicki from the GDI Hub, who's going to speak to us about disability innovation and accessible transport. Vicki, all yours.
Thank you so much. I'm going to start by trying to share my screen, which I hope that everyone will be able to see. And I hope that one of my colleagues will give me a wave to show me that we can in fact see my slides when that happens. Perfect, thank you. It feels like a real honour actually to be asked to participate in such a panel of people who have been working on and around inclusive transport for a long time. And it reminds me that GDI Hub we launched at the Paralympic Games in Rio, and one of the first things that we talked about was inclusive transport, because my co-founder, Professor Cathy Holloway, had done a lot of work with TfL on up in their lab in the north of London, where they built a tube train out of MDF or some kind of other equipment, and they've been testing kind of accessible routes onto trains. And I think the first thing I did as CEO of GDI Hub was to tweet, it's cheaper and more accessible to have platform humps on platforms. And of course, my professor co-founder didn't like that I put into 140 characters, a lot of work and a long study that I'd kind of summarized fairly briefly. But the point was important, that inclusion can also be the better outcome for everybody. And that's really the genesis of where GDI Hub came from. So I'm really unaware as to why that's the next slide that's showing. So I'm going to talk a bit about GDI Hub and then I'm going to move on. For those of you that don't know us, GDI Hub is the Global Disability Innovation Hub. We were launched out of the Paralympic Games in London. I led for 3 different mayors of London, one of whom is our current Prime Minister and was definitely not my favourite, work on disability inclusion. And we did lots of work to make the Paralympic Games in London the most successful ever, and also the Olympic Games the most successful ever. And probably my favourite mayor of London, Sadiq, launched us, as you can see in the middle picture, if you're able to see the slides, in September 2016. And we moved on quite quickly after that to launch in Rio and to undertake work around the world. And we're now lucky enough to be working in more than 35 countries around the world, addressing access to disability inclusion for a variety of people. Now, GDI Hub is 2 things. I run the social business, which we set up because universities can't always do things very quickly. And the research centre is based inside of UCL. We're also now a global collaborating centre for the WHO on access to assistive technology, which apparently is a big deal. If you want to afterwards, you can go on our website and look at what we've done so far, but we've been working really hard to reach 22 million people since we started counting in 2018. We don't do anything by ourselves. We work together with people around the world, and actually we have an MSc program running out of UCL. Top left, top right, you can see the innovation network we set up in Africa. Bottom right, you can see the World Report on assistive technology, which we're helping to contribute to. And bottom left, Daniel will recognise the gang of humans we're working with in Freetown, Sierra Leone. Lots of partners too. But we're here really to talk about inclusive infrastructure. And for us, that falls under a programme called 80-20-30. It's a programme funded, and I know we're going to talk about funding, in a broad programme of about £40 million of investment from FCDO in the UK, which is looking at access to assistive technology like wheelchairs, hearing aids, eyeglasses, and the such like for the 900 million people that need them around the world. That's nearly 1 billion people who need access to AT, and only 10% have it. That's due to double by 2050 with no predicted reduction in need gap. So we work on 4 areas to address that. And one of those is access to inclusive infrastructure. I think we were going to talk later about how things are funded. And so I've included really for reference the whole lot of work that's gone behind kind of making a case for and an argument for this is an important piece of work, and people can look at that afterwards if they choose. But just to say, we're working in about 35 countries, mainly in Africa and Asia, addressing this problem so far. We reached about 22 million people. Now, we made the case really strongly that inclusive infrastructure, including transport infrastructure, was a vital part of the story of disability inclusion. Actually, I was really surprised that people found that a unique argument to make, because, you know, we know that disabled people make up 1.2 billion of the world. We know that access to things like transport and urban infrastructure is one of the biggest problems for people living in lower developed countries. And we know that disabled people are concentrated in the global south. So it seems to me quite obvious that we need to address inclusion for people with disabilities or disabled people in that context. So we've set about doing 5 case studies of urban infrastructure accessibility to understand the lived experience of people with disabilities and to co-design solutions. We've done that research through my Director of Inclusive Design, Ian McKinnon, and Michaela Patrick, who's been recruited to work specifically on the project. And we've tried to look at what does good inclusive design look like and what does an inclusive city look like. The case studies that we're working on are the ones completed are in Ulaanbaatar, Mongolia, and Varanasi, India. We're currently working in Nairobi, Kenya, and about to start in Freetown, Sierra Leone. And so we're just completing in Indonesia too. And our aim is to work with the local teams and local partners in each of those locations to enable us to understand some of the issues and problems. And I'm presenting for you here, I hope you can see the picture, some examples of what we've seen. So I think those of you that work in urban transport probably won't be shocked to see some of these images. So on the left, we've got someone having to push their own wheelchair up a hill in very heavy weather. We have someone with a visual impairment trying to use a bus that's really inaccessible. And we have a wheelchair user needing to negotiate the roadway because the footway is so inaccessible. And sadly, these are not unusual examples, remembering that we are talking about the life experience of 1.2 billion people here. In Varanasi, India, we found similar but related problems. So the use of assistive technology like wheelchairs in inaccessible public realms is something which we find is often problematic. I think Daniel might have himself tried to negotiate a wheelchair across an inaccessible public realm in Freetown in the last 12 months. But obviously, when we're looking at lower income communities, we also have kind of informal uses of those spaces as well, which means that it can be further rendered inaccessible too. Our study in Solo has also seen us finding kind of perhaps more developed access solutions, but ones that haven't always been thought through to conclusion. So the picture on the right, you'll see some tactile paving and a ramp that's been added, obviously to intend to make the space more accessible. I'm not convinced it is successful really in its attempts to do that. And it also helps us to realize on the left-hand side that how spaces are used informally and ad hoc can actually make a big difference. So that tactile paving there has been used to help prop up a market stall, which is obviously not very helpful if you're following it along the route. I think we've tried to use really innovative research methods. So we've engaged disabled people and disabled people's organisations every step of the way. And that's been so vital to us because, you know, although our organisation is run by, staffed by and led by many, many people with disabilities and from diverse backgrounds, we aren't experts in every sector and every area that we go to. So you'll see the diagram that we did journey mapping in Ulaanbaatar with some of the participants there. And we've tried to use new solutions too. So the tactile journey map that we made in Solo, as you can see on the picture, was fashioned by participants to enable visually impaired participants to participate in the process as well. And I think it's easy to forget that actually the design process that we take to design the solution can sometimes be a barrier before we even get to the solution. So it's something that we can all, I think, always think more about. And I wanted to kind of just reflect before I move on to the other speakers, and maybe we can talk about this a bit more in the questions on the core sort of elements for discussion today. For us, in terms of diagnosis, we don't try and diagnose from the outside. We always work with users, which is why it was important, or users of AT or city users or kind of participants in our studies, because it's not you know, it's not rocket science that you design better products, better outcomes, better transport networks if you ask people who are using them. And I'm sure you all know very well that different users use transport networks in different ways. And so it's been really important to us to be led by the user experience. In terms of engagement, we've tried to use some tech and innovative approaches, but also disruptive partnerships. So bringing people to the table that you don't usually expect to have a conversation about inclusive transport has been really important. So we've brought health colleagues into discussions about assistive technology, for instance. Funding's always tricky. We've found that actually bidding for small amounts of money takes about the same amount of time as bidding for large amounts of money. So we've not bid for that much smaller funding. And actually, when we got £10 million grant from FCDO, we didn't have a bank account. So that probably goes to show how much we're kind of blagging it along the way. So I don't think there's any sort of proper answers to all of this. And colleagues said to say where you get things wrong. And that was possibly one of the ways whether we got things wrong along the way. But I think leading change is vital. People are scared of letting the people that are experts on the situation get in front of key policymakers. And I think for us, that's been a massive route to success by having people like Asian Development Bank, who are now actually paying the Disabled People's Organization in Mongolia themselves to do work for them. We've cut ourselves out as the middleman, and we find that a huge success in the process. And then finally, scale. I mean, I don't want to get really abstract and academic about this, but if citizenship is a perverse confluence, then so is kind of scale. Quite often people talk about wanting to do inclusion at scale, and everyone thinks they're on the same page and they mean the same thing. And quite often they mean entirely different things. So for me, just getting kind of clarity on what you mean, what do you want to scale, when, by who, can be really, really important. And for us, again, no detail on this, but we did some work mapping how we did disability inclusion in London 2012. And the short version of a really long story is we thought that the bid for London 2012 was the start of this commitment, you know, led by the mayor and the government and really highfalutin people. It wasn't. It turns out from the research that this was community leadership. So disabled people from East London infiltrated organisations and bidding partners and got their message in by becoming members of staff, by lobbying, by arguing for change, and that's actually where it all started from. So the community already knew what needed to happen. It just used London 2012 as a mechanism, and that's not me trying to argue that London 2012 did everything right. Of course it didn't. And then it's just an example of one of the innovative mechanisms we use. So in Delhi, we mapped routes around the city by attaching sensors to the wheelchairs of a gang of slum dwellers from Manglapuri. That's me, that's Steve Hales in the middle, if anyone knows him. He's the head of computer science. And so it's quite weird getting the head of computer science in a slum thinking about putting sensors on wheelchairs. It's not a thing that people do very often, but for us, that's the bread and butter of how to do things differently. And I'll probably leave it there because the point is no one knows the answers. So let's get together the people who have the technical expertise with the people that have the lived experience and knowledge in order that we can find some of those answers that are locally and contextually relevant. And that's kind of what we're for and what we're about. Oh, and there's a final point there, which is just disability innovation from our perspective. It's, you know, it's easy to think about it as like a cool new app. It's not that. It can be a really boring policy, actually. It's about listening to the people who know best. It's about creating the partnerships that we need, finding the solutions, and believing that there are kind of creative answers to difficult, intractable problems. And that is me.
Thank you very much, Vicki, for such a thought-provoking conversation, and especially for sticking to time. Now we're going to move on to Luisa, who's going to speak to us about how to make mobility more accessible and sustainable.
Thank you, Daniel. Is everybody being able to see my screen? Okay, good. Oh, all right. So before I start, I want to tell a short story of why we do what we do. 17 years ago here in Bogota, we had a catastrophic event that I would say it marked the story of Bogota regarding children mobility, where 21 children lost their lives on their way to school 17 years ago. They were in a bus, and due to unsafe conditions of the school bus that was transporting them, we had this catastrophic event and accident. And since then, I would say the city had focused more on studying what happens in mobility to school. And in our analysis, we have found that 9 out of 10 children move to school by bike, on foot, and in public transport or school buses. These children, more than 1,000 children in Bogota as well, are victims of road traffic crashes every year, and 50% of more of them are pedestrians. So we have been focusing really in these numbers. And also, I think this is very important, 40% of children in Bogota that we have interviewed, they have said that they don't feel safe at all in their surroundings of the schools. And this gives us an idea of what how they perceive their safeness. For these reasons, we decided our measures had to focus on improving travel experience for children, because lacking a good travel experience on the streets and feeling unsafe could lead to losing lives, of course, but also could lead to children giving up studying and giving up to the right to study, right? So we have, to give you an idea, we have a number of 2 out of 100 children, they abandon their studies every year in Bogota. So we came up with this idea, Kids First. Kids First is a big program that has 7 little projects. And today I'm going to talk specifically about 3 of them, which are the ones that are focused on sustainable mobility, active transport, but also community engagement. So the Kids First program I'm representing today is also a program that we execute day by day with more than 300 people. And what we aim to is to improve children's travel experience and guarantee their access to education, right? So we propose alternatives where children can access education without mobility restrictions, based on community inclusion, sustainable mobility, and road safety principles that we follow since 2017 regarding to Vision Zero. I don't know if some of you know about Vision Zero, but this is like a global policy where we aim to zero road deaths in road traffic crashes. So Our projects that directly involve the community and are focused on active transport are these three. So we have CMPS, we have Al Colegio en Bici, and a like little brother of Al Colegio en Bici, that is bike mates, I would say. So CMPS is like walking caravans to school. Al Colegio en Bici is bike to school, and bike to school has a little brother, which is bike mates. I will explain more. And the last one is Movi Parque, which is like a city big puzzle. So through CMPS and Al Colegio en Bici, we escort children to their schools. We teach them safe behaviors, we teach them bike mechanics and how to ride a bike properly, but also how to behave with other stakeholders in the road. With Movi Parque, which is a big puzzle that simulates a city, we teach them how to interact with other stakeholders, and these all of them create like a culture for future generations that probably would respect life even more, right? So we have some innovative components in these projects. With CMPS, we do something special that is playing. We not only go to school by walking, we also go to school by playing. So these allow children to develop some skills, engage with the community, engage with different ages. And this is like the cherry on the pie, as some of you say. And with Al Colegio en Bici, what we do is teach them how to interact with the city. So we sometimes do these big expeditions where we travel not only to school, but we travel to other places in the city to show them other new places, new parks, new places where to have fun and to interact with the city in other ways. And Bike Mates, which is our newest program, is for teenagers. So, sometimes teenagers don't like to go escorted by someone. They just want to go on their own. So for teenagers who have their own bicycles, we create Bike Mates, which is like supervising them on the areas they usually move to school. And we are like in the distance, supervising them with radios and just letting our traffic control center know if something happens, and that's it. And for Movi Parque, as I mentioned, is a big puzzle that simulates the city and teach them how to interact. So this is also like a way to go school by school, teaching little children, how to behave and how to understand the city by simulating a small city with this puzzle. So to create CMPS and Al Colegio en Bici, we started by analyzing the whole city in 4 dimensions. The first one is the social the social dimension, where we analyze it, where children were living, where they were studying, and where the schools were in the city, like the density of schools. Also, we had the urban dimension, which analyzed the state of the roads, the pedestrian pathways, the bike lanes, how was the infrastructure. And we also had the mobility dimension, which was related to recognizing the areas in the city where children move more on active transportation. And we also had the safety dimension, which analyzed like personal safety events and also road crash events. When we crossed these 4 dimensions, we had the most critical areas in the city where we need to start working on. So when we had these critical areas, what we do was to approach the community who live in these areas and ask them what were the most important problems they could see. And regarding road safety, the community mentioned also excess of speed, lack of pedestrian infrastructure, signaling and traffic control, and presence of large vehicles. This last one, presence of large vehicles, we know is very important because children are this size, are very small. And when we have these big and huge vehicles, they are not able to see them when they're crossing the street. So parents, specifically parents, were very concerned about these 3 points in road safety. And in personal safety, drug dealing and maybe thinking their children could be robbed or kidnapped was one of their big fears, their biggest fears. So we got all of this input from the community, and we work around our projects to include this and to think how we could change their perception of the travel experience and the way to school. And we start from a point on like engaging community. With CMPS, we did something I would think is also innovative. The more children work with CMPS, the more they could collect some stickers that we call calletones. And with these stickers, they could exchange prices. So they could have like bags or jackets or t-shirts. And that was like encouraging children to join more and work with CMPS. With our Colegio Bici, our biggest incentive was the bicycles and the kids. We gave kids, helmets and reflectives and lights, and just giving them bicycles. This helped them a lot to join us. These were like the biggest incentives we managed. And then after we integrated all of these input of community incentives and also the analysis we made, we could start expanding in the city. And now we are in 15 out of 20 areas of the city. Our biggest and latest achievement is that we expanded to the rural areas of the Bogota, which is this area like Ciudad Bolívar and Usme. And this allowed us to benefit children who live in the surroundings of the city, not only in the center and in urban areas. We have benefited more than 35,000 students, also escorted more than 2 million trips. But also we have like perception indicators. 82% of students have a high perception of safeness on their way to school now. And also 50% of parents feel that their children have changed towards becoming more like energetic when studying and having better academic results. I just want to mention shortly and briefly these other 3 projects, which is school zones, school lane, and smart school bus, which also help to create a safe mobility for children in the city. The first one, of course, is traffic calming measures through signaling and reducing speed. So we have a 30-kilometer limit speed on school zones, and what we do is just vertical and horizontal signaling to reduce the speed. And we have benefited more than 2,600 school zones. Also, more than 600,000 people has benefited from these measures all around the community. And this helps us for children to change their perception around their schools. We also have Ruta Pila, which is a smart school bus. And we check vehicles and their conditions and their legal requirements if they are complying, just to see if children are going safe on their way to school when they are traveling in school buses. So with this, we have benefited more than 200,000 children and also checked more than 30,000 buses. These are other measures that have helped us to reduce the number of deaths in the city by 35.6% and saving on average 65 lives. Sorry, I sometimes get with my English. With all of this, and our main motivation is like to promote an environment of trust among children, families, and guides, and working to make them feel safer when they go to school. We want them to feel confident and safe when they go to school or move around the city. We want children to feel autonomous, feel free, and feel that they can be empowered of their city and that streets are theirs. These are Bogota's achievements regarding school mobility. And yes, I'm excited to talk more about funding and engagement with the discussion we're gonna have. So thank you so much, Daniel, for inviting us.
Thanks, Luisa, and another amazing presentation. I am always happy when our speakers also stick to time. And we already started having some very nice questions in the Q&A. There's one for you, Luisa. I think Vicki has already answered one. There was another one on the chat. And we are moving forward with our webinar with Lorraine Darcy, who's going to talk to us about how do we design more inclusive transport systems and streets. Thank you, Lorraine.
No problem, I almost forgot to unmute myself. You'd think I'd know at this stage. Hi everyone, so my name is Lorraine Darcy, and I generally introduce myself as being both a civil engineer who has had experience in implementing the physical environments and traffic environments, but also as a behavior scientist trying to understand why and what we do. And so the perspective, that's the perspective I'm going to take today, and hopefully the slides move for me. Why is the slide not moving for me? Sorry. Second. Changing on one screen but not the other. Apologies for this. Not sure what's happening. There we go. So so I suppose theoretically frame on this is that like behaviors don't happen in a vacuum. So we really need to understand about the personal determinants. So like, you know, so like what's happening with an individual, what's happening with the environment, and decisions around their behaviors. And okay, it's after happening again. My screen keeps popping things up. And so and like really we need to understand the system of behaviors before we decide how to intervene. And I'm saying this in the context of as an educator of engineers and planners who generally
Lorraine, we've lost you. If you can, you've frozen. I'm going to send you a text and see if you can rejoin us.
So maybe while we're waiting for that to happen, Jim, we could like perhaps just have a look at a couple of these chat issues. I mean, I was looking at this one that Professor Ogo was stuck in there, which is this thing about, you know, if the city is dangerous, then you know, how do you do all these things when the city is just dangerous for everyone? And she was pointing out about motorcycles, but when you have crazy traffic conditions, generally it makes it really quite hard, I think. So I don't know, Luisa, it seems like there might have been a lot of additional work going on to make Bogota a safe place to be anyway.
So you're asking me if there are more like additional measures to make Bogota a safer place? Yes, well, we have other measures in the city. During the pandemic, we implemented the 50-kilometer limit in the whole city. So that's the maximum cars could go in the whole city and the whole area. And we also implemented the speed cameras in the city recently, just like a year ago. And all of this has been helping us to reduce crashes. I would say these are like some side measures.
There were a couple of extra questions while we give time to Lorraine to reconnect. There was one for Vicki that I know you answered, but maybe the rest of the audience would like to hear a bit more about that. And is that disability is not only physical, but also their cognitive disability. So how can we deal with this in terms of more inclusive transport infrastructure and services? Vicki, you're mute.
We work with people with a range of impairments, and actually we try to work overarching individual impairments. You know, we try and move beyond the kind of medicalization of disability and think more about the sort of social construction of disability really in context. So you'll have seen on the slides, there are notable people who are part of our gang who work alongside us, who would have fit into that category. We're also working closely with Special Olympics actually on thinking about how we use the power of sport to further inclusion, and doing a programme of delivery across schools on that as well. In terms of use of transport, people with intellectual impairments have been part of our studies. I think you might have seen that. But we haven't done a specific study on how people with intellectual impairments, of which there'll be many different answers, use and need public transport or elements of transport infrastructure. I mean, it's an interesting question. I wonder if others have done that work. Yeah.
That reminds me, I didn't personally do it, but in a book that we recently edited with the Interlink Network about Latin America, there was this study about how patients from psychiatric hospitals were moving around when they had a chance to engage with the city. and it was very interesting how they perceived different barriers of the space. I'll be happy to share that later and for everyone in the chat. For now, I think, Lorraine, are you back with us?
Yes, I'm back. So let me see.
Okay.
I can't start my video yet.
Let me remake you a co-host and we
Yes.
can pick up where we were.
So I was asking Jim by text there how far you saw, because I hadn't realized I dropped off online until I got the message saying reconnecting. So I might need to go back a little bit.
Yeah, Lorraine, we saw
We
you were
hadn't
just
seen the
starting to explain the system.
Okay. So, so I can change it here. Okay. Yeah, so I was talking about intersectionality here. This, yeah. So that I got in my thoughts again. So that, you know, it's not just enough to say that there's a difference between male and females as we perceive the environment, but also across the life course, and that goes for any group of people that we have different experiences as a young person, as an older person, and different life stages. But that we look at gender within the context of that, or ability, or other considerations. And one of the findings that we had in our Horizon 2020 project called Diamond, which was specifically related to gender and transportation systems, was that while women experienced more harassment on public transport, that trans men and male and females, they experienced even more again. So that, you know, so the more we understand about each individual across the life course, and the more intersectionality and information that we collect, the better information that we can have about how people feel and experience different transport systems. Here we go again. Is this going to change my okay. No. Oh. There we go. Great. And so from the perspective of communicating this with stakeholders in the built environment, that, you know, the streetscape becomes a really important part of the systems that we provide. And I know these are nearly all, well, no, we have Bogota in there, but the rest are all European examples. But, you know, and that the streetscapes are an integral part of our transport systems, because our trips, they start from our front door. So you can have a really good public transport network, but unless you have a safe and comfortable space from the front door to that transport system, well, then it fails down in its connectivity. And hence, when people will look for private motorized vehicles, if they can afford them, from their front door. And I like to share this slide because when I did my own PhD work starting out, when I was trying to, you know, understand what is walkability, what do people see as a walkable neighborhood, I found that the metrics that I was given, or the measures that that were indicated to me from those that were involved in transport planning, engineering, you know, they listed lighting and, you know, segregated paths and protected paths and all the rest of it. So they, you know, but this was the result of that: safe places to cross, but which is a really sterile environment. But these are the things that they are looking to put into a neighborhood, and therefore design, you know, what they think is a very inclusive place. However, this is not a very safe or inclusive place from the perspective of a user that is all alone there late at night, and particularly if they're feeling more vulnerable because of their gender. And again, another example of where, you know, it could be like, you know, in principle, you know, all the best of intentions from the designer's perspective was this was a great infrastructure. We spent loads of money on it. We put in lighting, we put in smooth surfaces, we considered all of the factors, but really they hadn't thought about how it feels, and that sense of security in that space and comfort. And then again, and this has already been mentioned by others, like, you know, when we talk about somewhere not being safe, is it safe from crime, or is it safe from traffic? And another finding in my work was that sometimes the safety from crime is from often reported from people who are not familiar with the area or don't necessarily live in the area. So there's a sense of community and belonging that sometimes people perceive an area that they might consider a lower socioeconomic status or a more deprived area than where they're living is inherently unsafe for them to go to, and therefore would avoid it or tell people not to go there. Whereas when people actually live there and they know the community and they're familiar with the spaces, they don't feel that so much. And sometimes then, you know, it's the same kind of perspectives with traffic, and something that we need to understand a little bit more. But land planning has a really important role in this, and the permeability that comes with that land planning as well. How easy is it to move through that space? So again, just the findings, and this is where we asked people in 16 different neighborhoods around Dublin that how would you travel to a list of places that were relevant to those that they didn't travel to were excluded from the analysis. And just when we scored it, that the active trips, walking, cycling, you know, they scored a 3, public transport a 2, and you know, because taking into account that every public transport trip does involve an active trip, and then a motorized a 1. And what we found was that there was a significant difference between the areas that, now what I call low walkable, not deprived here, are some of our new suburbs. When our suburbs were built in Dublin, they don't have the same access to place, and therefore people were more isolated in those places. And then our low walkable deprived neighborhoods, they weren't as old, like they weren't as new. So some of these have been around 30 years. But again, they were in more isolated places in the city, and there was a significant difference in the amount of active travel people were using. So, and if we are excluding people from our, you know, transport systems that allow people to walk, cycle, or take public transport, we are therefore forcing them into a car dependency or transport poverty if they cannot afford a car in those places. So we really need to have to put the human at the center. So because if we plan for people and places, we're going to get people and places, you know, rather than actually having what earlier, as I pointed out, their architecture. And we also can't assume that we know what an individual or a group's motivations or barriers are without engaging with them in a meaningful way. And, you know, sometimes this can be quite difficult because you only have the opportunity to ask certain questions in a certain time scale in a certain context. So in TU Dublin, we've been working with Walk 21 and Sedeus in Chile and a number of different stakeholders you see there, and developing a walkability app, a measurement tool that allows us to collect information basically anywhere, and this perceptual data reported. And you'll see there in the setup profile in the middle that, you know, people get to report on their gender, their ability, and their age. So the child, teenager, adult, elderly. And they also have an opportunity to tell us a little bit more about their trip, if it's a necessary trip or a trip that they're taking by choice for leisure, etc. And this is kind of a step 2. It's a kind of a phase 2 of a project. The first part happened in Colombia and on a number of different places around the world, where the first iterations of children went around physically with the different traffic light colors and reported you know, what they thought was good or bad about their neighborhood. So this really now is an electronic version of that, and we've done extensive engagement with quite a number of stakeholders around the development of this, seeing it as a tool that we can, you know, that we can all work together on the implementation of and the development of. So, oh yeah, so as I said earlier, this is the gender, ability, age, but also the decision to, is there transport or leisure? Are you traveling alone or with a dependent? Because again, and particularly from a gender perspective, that we often see that, you know, the places that you will go on your own, that, like, you'd be confident going on your own, you may not be confident going with a dependent if you're dragging a toddler along with you, or then if you're with a group, you might feel safer in some places than if you were out alone. And then, as I mentioned before, about the familiarity or with a location, or if you're a visitor to that location, because that might influence how you see a place. And some of these are just indicators that we have in the app. And just on reporting back, what is it about? So more detailed feedback. Now, it is just enough, people can just say whether they think it's a green, orange, or red in relation to the functionality of the place. But if you want to report in more detail, and it also gives the functionality to give a text response as well. And I just wanted to finish on this slide about leadership. And this is an Irish example. where TII are one of our main transportation agencies in Ireland. They're traditionally responsible for our roads system and our highways, but also they've in more recent times been involved in the delivery of light rail. And one of their staff members was at an international conference, transport conference, and just happened to pass a room where she saw that there was a presentation on women in transport. Not something that was on her radar at all, because again, traditionally in our engineering training or planning training is not necessarily something that's been talked about. But she went into this room and she said she became fascinated by this whole all this information that she was receiving, and went back and commissioned this report. And this report has actually had a massive traction in Ireland. And it's amazing that when the message comes from the right people, meaning when the message comes from within the organization, it is having a huge impact. So we need to think about how do we enable people to take leadership and to get the message out within their own organizations, and how do we facilitate them talking to wider groups and consider and how that gets considered into their work. So that's me. Thanks very much, and apologies again for my internet dropping.
Thank you, Lorraine. No worries at all. We actually are very good on time. We have 40 minutes for our discussion and our interaction with the public. So please, everyone attending the webinar, feel free to keep posting your questions. I have tried to categorize them, and I'm going to be cheeky here and steal Vicki's slide to sort of introduce our next part of the webinar, where Jim is going to cover in a small wrap up these different 5 points, and we're going to start a conversation around how do we conduct diagnosis, citizen engagement, how do we get funding, how do we lead for change, and how do we scale up. So Jim, over to you.
Yes, thank you, Daniel, and thank you, everyone. Wow, what a great series of presentations. It feels quite difficult to follow on that, because I think what you've outlined there just feels so hopeful, I guess. I feel really enthused at all the possibilities. I think what you've highlighted for us, though, is just how hard you actually have to work, how proactive you have to be. But I wanted to reflect on a few things before I go through this list and sort of engage you all in thinking about these points. The first thing I heard in connecting between the three speakers was that quite often there's something happens in order to spark a sense of the fact that things aren't quite as right as they should be. Vicki talked about the Olympic moment, and however plotting it was in advance of that, and I know I was part of that plotting work, to infiltrate the agenda. There had to be a moment in time when something was going to happen and we thought we need to be better than we are now. And if we set that in a sensible enough point in the future, then we have to get organized, because that point isn't going away. And I've seen things like the Olympics being very helpful to hang various projects and initiative and as an enabler of change. It was very sad to hear from Luisa how that in Colombia's point was actually a significant tragedy. And those tragedies are happening all the time. It's extraordinary to me as a campaigner, particularly for pedestrians, when we have 310,000 people killed a year as pedestrians on the roads, we seem to have got numb to these figures. But certainly when we get above 20 all at one go, it feels significant. But these sorts of numbers are churning out all the time. And I know there are streets in Bogota where there are more than 60 people on a single street being killed a year. And you sort of think, is it about place? Is it about a moment? I think all of these need to be captured and thought about, people brought to task really, and think, actually, we're going to have to do something about this. And for Lorraine, I mean, you described it quite rightly there about someone who just happened to be walking past a room and got pulled in. But, I think it just illustrates we don't necessarily have to wait for a significant moment, for us to hold the Olympic Games, in many of the countries where we're living, that might not happen again, or it might not happen ever. But we can't wait for these things, can we? And actually, the fact that someone was willing to commission that research to really start thinking about why women weren't more included in transport decision making, it did highlight the fact that I guess it identified the fact that there's a gap. And I think what we've seen from all of our speakers today is that the moment you can highlight what that gap is, then you can get organized, get people on board to support that, and think about how we're going to jump into it and make that gap less. The second thing I heard was how we often talk about road user hierarchies, and we've looked around the world, and you can see now that, you know, in a positive sense, more than half the world has positive policy for walking and cycling, at least. And I wonder if, Vicki, if you had looked at global policy for engaging people with disabilities, whether, Lorraine, you were to do a scan about whether women are included in proactively in policies, or Luisa, whether you felt that children were engaged or certainly even considered in a policy point, particularly around transport, maybe. I wonder how many times a quick word search would find how many countries have actually significantly gone out their way to make sure these people are included. But maybe what we've heard today is the beginnings of a bit more detail around what we really mean by road user hierarchy. Many countries do adopt this idea that it's people first, or pedestrians, and then cyclists, or people with disabilities certainly are up on that list. We then have cyclists. You'll be familiar with the idea of public transport users, and often motorists lower down that inverted pyramid. But I wonder whether what we need to actually include here is a greater hierarchy about making sure we don't just say people or pedestrians per se, but actually spell out, you know, maybe this is our chance here to actually spell out, let's make sure women, let's make sure children, let's make sure people with different abilities are included from the beginning. And maybe this agenda needs to pick that up. Just two more reflections before we go into this detail, and we'll have more of a conversation. The third, apart from the fact that I felt like I want all of this, and in Vicki, it's extraordinary that you've managed to grow within what is basically a 10-year period. You're already reaching 22 million people. You've gone from 0 to 22 million. Talk about scale. I mean, that's awesome. And, you know, Luisa, when you were talking about children, I think you started off by saying 9 out of 10 are effectively in Bogota going to school in a sustainable way. You know, there'll be plenty of countries who will be very envious of such high targets. And Lorraine, you know, I know we don't necessarily know at the moment about women from a Dublin point of view, but I think the way you laid out the systems approach there, you're well aware, and I think that report proves it, is that women are choosing to motorise where they can afford to, faster than men in Ireland. And we think, certainly when we ask them, it seems to be because of the conditions, the environmental conditions. So this relationship between behavior and choices, where it's affordable, is certainly having an impact. And I think those trends are creating a new sense of order, I guess, in political priorities. We've heard about Vision Zero. We've heard about, you know, you'll know about net zero. I wonder whether we need to invent a new zero around making sure no one is left out, and whether this is a chance for us to think about making sure that inclusion is something that is an unavoidable priority for the way that we target and develop our policies and projects. Last point then, and I was really taken about the fact that all of you referred to the fact that traditional ways of collecting data, you know, if we really thought about how you could look at deaths, you know, it's a pretty blunt instrument, but we know that actually, yeah, negative zero, thank you. I don't know what negative zero is, if that's mathematically possible, but maybe that's a good suggestion, thank you. But when we think about traditional ways of collecting data, we can look at the numbers of people who've died. We can look at the numbers of people who are on the streets, but I think, Vicki, you made this point particularly, that very often people aren't there because they don't feel welcome, or they maybe haven't even got the access in the first place. And therefore, if they're not there, they don't get counted. And so we have to be a bit more clever. And what I heard from all of you was a reliance, and particularly Lorraine, when you were talking about proactively inviting people to share their perceptions, it is about asking, maybe the ultimate measure is around satisfaction. You know, do you go at all? And if not, why not? And what's it actually like? In all the things that you can measure, and we've been working recently, particularly in Africa. I know there's some of you on the call who are part of our network in Africa that we've been growing with, UN Environment especially. Actually, nothing really matters. You might have the best policy, you might have all sorts of other metrics, but if it's horrible on the ground, which is, you know, we have to come up with maybe a more scientific term, Lorraine, than it's awful or it's horrible. But you know, how do we unpack that and find a way that says, well, that just doesn't seem fair? And I think what you've all done is demonstrate to us a way of turning that obvious feeling that we have when we walk down the street and know, you know, crikey, this is horrible, or there's definitely something we could do here to make it better, and think about that in a systematic way to make sure that people feel that they have better access and better inclusion. So there's a few quick thoughts, and you might want to react to some of those, but I suggest now in the last half hour that we have together, I'd really like to run through Vicki's awesome list here. You gave us an absolute top head start in thinking that if we could only get these 5 things right, wouldn't we all be okay? And I've asked all of the speakers really to give us a bit of an honest. You made it all look so easy, you know, when you throw us through these colorful slides and you tell us how you've gone from 0 to 22 million. You've got 9 out of 10 kids all doing the right thing and everyone's happy. What about these users, the diagnostics, as you call it? Let's have a little conversation about that. Feel free to reveal the flaws and the barriers, the things that you had to overcome in making sure that no one was left behind. What about this sense of, how did you create that argument that said something's not right here? It must be that we have to do more. I wonder whether, Vicki, you talked about the need for better outcomes. I love that. I think, you know, having an outcome focus from the beginning when we're talking about users makes sense. But was it easy to understand what that outcome was? Vicki, give us a sense of, at what point did you focus in and realize what the outcome was? Did you have to then just talk to everyone and work it all out? Was it a consultative process, and did that take weeks or months? When you talk about engaging users, what does that really mean? Okay,
so a couple of things. Thanks for the really great summary, actually. That was really powerful. And, you know, I'm really happy to reveal everything we don't know, as well as everything we do. And so one of those things is that 22 million reach figure is a set of FCDO, you know, things that you can measure, which, you know, does go some way as a proxy indicator towards understanding, you know, having a sizable impact. But many colleagues, myself and Daniel and others in the DPU will have opinions on how much that really doesn't measure kind of, you know, real outcomes for people over time. So the first thing to say is we absolutely haven't got it right. So 2 examples maybe. First is the Delhi Metro. So we work with Asian Development Bank on a TA across their work. For people that don't know, Asian Development Bank are building most of Asia with lots of money from Japan and the USA and lots of other places. And they're doing so with great intention, actually, on inclusive design now. But when the investment grant was designed for the Delhi Metro, one of the things that was done was it was decided it would be accessible. Good. And a line was drawn around the Delhi Metro and all of its stations to ensure that it was accessible. And it was. The fact that the nearest bus stop was slightly outside of that line, which meant that it wasn't actually accessible because you couldn't get off the bus because the curb was too high and then into the metro station, was something that wasn't considered until afterwards. And actually, it's a really good example of, I think my colleague Margaret Hickish, who led inclusive design for London Games Time, who sadly passed away really recently, said that inclusive design is 1,000% more expensive to design in afterwards than it is to design ahead of time. And so that really good example of how much would it really cost Asian Development Bank and Government of India to have slightly widened that red line to the nearest bus stop, probably not very much. And so that's one good and probably confidential example that I hope the 27 people on this call don't report back to my client at the Asian Development Bank. Another thing is to your point about, you know, when people are missing, you can't see them. So you don't know they're there and you can't design for them. And, you know, big tech companies know this, so they are intentionally employing and designing with people with a variety of impairments, because that's how you get better products which sell more. So the commercial sector has got something to teach us here, and I don't say that lightly, in terms of how you engage in people designing really good solutions. And so recently colleagues told me that, you know, in Bangladesh, they've done a number of surveys and they found out that actually, you know, women don't really go to work that often. And this isn't ADB, I have to say. Women don't really go to work that often. So there's no need to design public transport that directly relates to women's needs. Well, actually, the surveys we did in East London shows us that women do a variety of trips, stopping many, many times, taking the kids to school, going to the market, often going to work, various other things. So the design needs are different. But actually, those colleagues just said no to disability. There's no point. Disabled people don't get on public transport. And we had to say, well, yeah. Why? It's because we weren't able to. So
yeah, you've hit a very interesting point there, and thank you for being for sharing such honest thoughts here. 22 million, you know, it's a hard thing to actually justify, but I'm sure it makes everybody at FCDO, as you say, probably quite relaxed that they've been so successful in such a short period of time. You know, Luisa, you talked about 9 out of 10, I think, students. Are you pretty confident that you've engaged with that many people? Do you feel like you've reached everyone you need to actually come up with your program? And is walking, cycling, and your other program about sort of areas in cities, do you think you've swept everybody up into your 3 programs, or will people fall between the cracks? Because you've got to come up with a system somehow, haven't you?
Yes, I don't think we are engaging 9 out of 10 children in the city, actually, but we were looking ways to do that. But I think this is where communications play a big role. And you still ask people, like people on the streets, if they know what's Al Colegio en Bici, what's CMPS, what's all of our projects, but they don't actually know they exist. So we are working in like each time promoting more our projects. First, we want people to know them. And then we want, if there is a big need of having us, then let us know. So for working towards letting people knowing, we have been creating some materials in the last years, like a documentary that explains what are these projects, having social media, very active social media, interacting with people who write to us, also having more open channels for schools that want to contact us and that we are like working with them. And we have been like working on that. But to be honest, still, even in our same secretary, in Mobility Secretariat, we have people that they don't know what our projects are. So this is like a challenge that we are overcoming in the last years. Yeah, I would say that towards like including more children.
Yeah,
we still have a way to go. Mm-hmm.
Yeah, no, you know, it's an imperfect place, isn't it? And we're working out a way to demonstrate that we're doing our best. And I think you have to have a sense of reasonableness. And if you sort of think about how many people, you know, when people are maybe engineers, but Lorraine, if I could lean on your at least 50% of your side that is an engineer before you talk about your behavioral scientists feeling, you know, I wonder how many engineers are engaging with road drivers, with motorists, before they decide where to put the road and how to design it and whether they feel it's in the right place. You know, do you think it's fair that we have to work so hard to engage people, which if you put together women, children, people with different abilities, it's probably about 75% of the population anyway. To what extent do you think that's fair, and how are you going to get around maybe supporting engineers to think more about people than design in the way that people have traditionally, as you described it?
Yeah, no, it's been a difficult Yeah, it's been difficult, and primarily because it involves a whole cultural change within the industry. So it is like traditionally a very male-dominated industry, but very reliant on standards, the design standards and metrics and measurements. And, you know, this is the way they have been taught. They have been taught from the perspective of getting the turning radii correct and the type of surfaces that they've used. And that is what they have been taught, rather than inclusivity in the systems. And as well, like, you know, and unfortunately that's still being taught, and a lot of the like engineering curricula are still focused on that, and it's taking a bit of time. So like, you know, we've now set up an MSc in sustainable transport and mobility, which we've opened up to be multidisciplinary. And actually this was one of the most surprising things that I found, was that when we set up a multidisciplinary transport masters, there was this perception that engineers like looked down on it a little, because they, you know, they weren't going to get accreditation from the Institute of Engineers because not everyone on the course was an engineer. And, you know, like we're overcoming that bit by bit, but it was this whole, it's not about us, like we're above that almost, you know, that's not a concern for us. And, you know, like Louisa was saying there, like communications is a key part here, because I found that actually it was introducing different viewpoints, but in a very humanistic way, like by using narratives and photographs. And like those two photographs there that I showed you, I use them all of the time, and it's actually quite profound, the reaction they can get, because people genuinely think that they're doing the right thing in designing junctions like that. They genuinely think that this is the right thing to do by pedestrians, but, you know, they've never been taught to think about it more beyond the radii and surfaces and the lighting, etc. So there's a really strong communications piece. And even with policy changes that we have here in Ireland, like, you know, where we have, you know, a greater emphasis on placemaking, they kind of panic. The engineers kind of panic with that, because they don't have a background in it. It's not familiar to them. So there's a continuous education required. And like the familiarity, and I just saw a comment there that was put into the chat about it, you know, sometimes, you know, areas that are lower, like more deprived areas or slum areas aren't considered. And I think often this, because of it, people design from their own familiarity and their own norms and their own, and I love Kuzenbach's, like, you know, the way she puts it, like their veils of influence of their own life experiences. That's how they view the world. So if they're not familiar with the needs of those neighborhoods, then, you know, it's very difficult for them to design out of it. But interestingly, like, you know, I think some of the key ways to force change in that areas, because it's coming up, is actually putting requirements into government tendering processes, making sure that consultants have to address things, because this is another thing of, you know, a consultant is going to try and do the job in the quickest and cheapest way they can to deliver it. You know, sorry consultants, but that's their modus operandi. So they're not going to go out of their way to make sure that they're going to have a more inclusive data collection if it is not actually requested within the tender which they've signed up to. So, like, you know, there has to be initiatives from governments and from those tendering for these jobs to make sure that happens. And yeah.
That's a really good point. That's a really good point you make there. And I want to pick up on this sort of role of teachers as educators, I guess. And, you know, thank you, Vicki, for sharing about, you know, that you've developed this master's program as well. I mean, we find ourselves just as a charity increasingly being brought in by universities to sort of add, you know, training days to give some real life experiences of places we've been to, or sort of understand how people are adopting these things. I mean, Lorraine, you're, I think you've got some PhD students working for you at the moment. I wonder how many of them, you said that engineering is traditionally a male-dominated thing. What's your gender split at the moment in your current students in the way that you're teaching there in Dublin?
So we are still getting a higher proportion of males, but then I think that's kind of reflective of the industry at the moment. Like we have females attending, but I was really annoyed at the start we weren't getting more females, until I took a step back and actually looked at the proportions within the industry, and I was like, okay, well, we actually have a fairly high number of females in comparison. But on representation, I think the other point I wanted to make was actually that some of the students are finding it, particularly those doing dissertations that want to recruit people. So I have a particular student at the moment who wanted to talk to carers, and she's finding it really difficult to recruit them, because often people with additional needs or females with caring roles, they're so time poor. and under so many pressures that actually engaging in the conversations can be really difficult for them.
Yeah, it's this proactive. There are certainly roles, aren't there, in this reaching users, citizen engagement. There are blocks all the way about how to make sure that we feel as though we're doing enough job, a good enough job. And I don't think we should beat ourselves up too hard about this. I think I'm hearing this from all of you, that, you know, you painted a rosy picture. And I think for funders, you know, for policymakers, you know, they want to demonstrate that you're doing a good job, that you're reaching the people we want. But the reality behind the scenes is that there's always more work to be done. And it makes me think actually the role of Interlink here, you know, because I'm not sure we've ever done an audit of how many male, female, young researchers, people with different abilities. But, you know, hopefully I'd like to think that this network has that opportunity to change hearts and minds, and I think your point there, Lorraine, about continuous learning, you know, we shouldn't just stop just when we do get that one piece of paper, that one qualification, because we're all learning so much all the time, aren't we? Daniel, did you want to come in here? You are an educator. You're sitting inside a university. What's it like on the ground trying to teach these things?
Well, I think, and maybe Vicki can also comment there, coming from a development focused department, we get a very diverse, perhaps more than the average cohorts that you will get in other programs in the university. And one of the things that I have found is that not just about the makeup, we are seeing an increase of women working on development issues, more so in transport. In the module I teach about transport and inequalities in global south cities, we get more and more women requesting spots on the module. But one of the things that we see is that when we sort of unpack a little bit the makeup of people in postgraduate studies, looking at working in development, most of them want to work in policy or in sort of the NGO sector. There is a mismatch, no, of experience. So we get male that are more vocal, that come with many more years of working on the field. Sometimes they cover, in order to paint a more positive light, what I see is younger women, younger practitioners, younger graduates that are getting more and more interested, more empowered to engage with this. And I think it's our role as educators to actually bring them in and sort of give them that space, which clearly, I mean, the demand is speaking, they're calling for it, and to sort of balance the play field a little bit. Jim, I wanted to bring in a couple of questions about engagement, because I see you're transitioning towards funding. Before we do that, there was a couple of comments in the chat and in the Q&A that I think are relevant. About buying from the communities when engaging with communities. A couple of examples that I think apply to all our speakers, but that initially were framed for Luisa's presentation, is has the community always been supportive? And I think that's a question for all our initiatives. And do you always have a buy-in from a community, or parents that have fear of the children walking or by bike to the school? And same, I think, probably extends to Vicki. Do you always get a buy-in from communities where you have a higher concentration of people with disabilities? What happened with the people that don't have disabilities? Is this seen as a priority? I think that's important. Sort of.
Yeah, no, great question. Thank you for sharing that. So let's be honest again, you know, does everyone want you? Does everyone want to be proactively engaged? Or were they so surprised that you even asked them? Was it actually quite hard work to get them to actually feel part of and included in the conversation? Luisa, tell us, what was it like engaging young people?
All right. So in the beginning, we didn't understand very much how was to engage children, and we started discovering that along the way. For example, we came up with a big list of games that we could play with children, and after 1 month or 2 months, they got rid of them. Like, they were really bored of playing the same games all the days. And they started even suggesting that we need to change the games and giving us games to add to that list. So I would mention that, but would also like to mention a story that when we start working in with a community, there was a group of moms who they were paid to transport children and escort them to school. And when we arrived to this area, we were basically seen as we were taking the job of their moms. Like, we were now not giving a chance or an opportunity for them to work. And what we did was to engage them to work with us, but also to engage them to walk with us, so that they could relate to the project, but also to see that we were like just integrating the community more. That was our goal, but that we learned along the way. And
interesting.
yeah, regarding what Lorraine mentioned, the strategy to show these faces where when children were walking, we also used that strategy, that methodology of creating like maps with emotions to kind of understand where children were feeling more like unsafe. And yeah, that's kind of
I love this idea of emotional maps. I think all of our cities should be strewn with emotional maps. They probably are, but we just need to sort of wipe it down and map them, as you say. Vicki, were you always welcomed, or were people surprised to find you? Did you? What was your reaction when you say that you're working with people? You turn up. You came up with a big idea really quickly. How did you actually get beyond that sort of mayor saying, of course I'm behind you, and then you saying, right, I better go and find some people who want that we can go and help?
It didn't come from nowhere. I guess like in East London, there's something called the Built Environment Access Panel, which is a group of disabled people that have been leading access work on and around the development of the park since about 2007. They were set up by the Olympic Delivery Authority. They moved to the LLDC. They still exist now, and GDI is willing to offer them a home. UCL might offer them a home actually. And they have a power of veto over all plans that go on the around the area surrounding Olympic Park. It's quite a big area actually. They've never used it because they're paid, they've been trained over time, they know what they're being asked to look at, they've become expert, and they work with the designers and the architects to do a really good job. So that's kind of like a sort of best practice example of how to engage people in a way that makes sense. The other end, and you know, there's a set of inclusive design standards that have been designed, and a set of principles that you can find on our website if you're interested.
Well, hang on. You're running through a massive list there of wonderful things. Is this what every country should have? Is this like, or at least what every city should have, like one of these little advisory? I say little, but an advisory group.
Yeah.
Set standards. Is that the sort of thing that could be transferred as something really practical anyone could use?
Great idea. And so the slide that I messed up that was in the beginning of my presentation actually said what we're doing in these 5 cities is testing those principles. And next year, hopefully with UN Habitat in Poland, we're going to launch this kind of global set of principles, which is just, it's not going to be more grandiose than this is what we've learned. This is what we think is important. And it includes like engaging people at the start, treating people with respect, believing these people are the experts. The other end of the spectrum, though, if I can just really briefly, to your point about education. So, in this country, even where we teach our architects in places like the Bartlett for years numbered 6 and 7, they usually have about 2 hours on inclusive design of the built environment. It's not good enough. It's not good enough. And it shouldn't take like external agencies to come in after the fact with design consultants to say, oh, this is how you save 1,000% of your investment by not doing something really silly and planning it in at the start.
Wonderful. Lorraine, 2 hours. How much do you think we should put on inclusive design?
Well, I love what has happened in UCL in relation to the civil engineering program, where they don't actually start teaching theory until 3rd year. I think that it was so insightful there of Nick Tyler and the team that were big.
You're cutting in and out a bit there, but I get the point that you're entirely supportive of the evolution of what's happening in some universities, and I think what you were highlighting was the fact that the theory comes after you've gotten beyond the principles, and I think that makes a lot of sense. Let's move on to the funding and leadership. I want to sort of couple these together. Yeah, Vicki, come on.
One thing, which is that disabled people who live in communities where disability identity is negative, so Sierra Leone and the slumdwellers we're working with, if you go and ask them what they think about transport, they're not going to give you an answer because, that identity is so shameful, is so hidden, is so misrecognized. There's a lot of work to do before you get someone to a position where you're asking them what type of public transport they want. And we are all responsible for doing that work too.
Yeah, it reminds me, Karen, when we went in Nairobi and we were working in some informal settlements there, and we said, right, what can we do about walkability? And they said, well, hang on a minute. We haven't got electricity, we haven't got water, yeah, we haven't got drainage, you know, can we just have, and I said, well, I'll tell you the answer to that. We can build a footpath and we'll put all those surfaces underneath it and we'll be absolutely sorted. Always the answer is walking, but yeah, actually even mapping these settlements would be a good starting point, as you say. So I think that realism, it's really helpful. Thank you, Vicki, for sharing that. Funding and leadership. I love the way that you said that you were blagging, and it's absolutely fine. We all do that, don't we? We've all applied for large sums of monies and think, crikey, the biggest problem we could ever have is if we actually got it, how on earth would we spend it? I've been in those projects and in those concerning places myself, although very often the bits I only really remember are the places asking for it and thinking we never have enough. You talked about 3 mayors, all different political colours, Vicki, and I wonder to what extent it is about political leadership, or whether it's about community leadership, or whether in fact you felt empowered as an organisation to sort of take that leadership and thread those people together. You know, what is it? Who do you think is actually holding the power here, and is that the key in understanding that power balance to actually unlock the money?
I think the trick is, it's okay if you're, in inverted commas, blagging, as long as all you're blagging is an opportunity and an offer to hold space for experts to come forward and design solutions. I think it's problematic if you're blagging and you're telling people you know the answers. I think, you know, very few people are willing to kind of hold that space and hold that risk for real answers to arise. So that's one thing. Political leadership is vital and absolutely the most necessary factor. That's what our research shows, and that's what all of our work has shown.
And how did you dance between one type of mayor and another?
So honestly, I hid GDI Hub from Boris until Sadiq got elected, and then I gave it to him as a nice thing to announce.
Okay, thank you very much for your honesty. Louisa, what about the politics? You've been through a political change there, that we've got a new mayor in Bogota. How did that transition go? Did your program suffer, or was it highlighted because of? How did you negotiate that?
Well, we were, I'm going to give the example of CMPS. CMPS was founded by Bloomberg Philanthropies, the first 4 years of operation, and it finished in 2019. And then in 2020, we had to figure out how to start being funded by the government. So Al Colegio Bici, which existed before, was like a door open for us, because if it already existed and it was funded by the district, it was easier to take CMPS to that vote as well. But what helped us was like being clear with the objectives of the project. In the beginning, in 2016, CMPS was like a happiness project. We want to make children happier, and that was difficult to measure. That was subjective, not objective. And when we did the impact evaluation, trying to measure happiness was like, oh my God, what did we do? So we changed that to perception, and safeness perception was easier to measure. And in the impact evaluation, we were able to have those indicators to demonstrate what the impacts of the project were. So that helped us to convince the new government.
That's very succinct. I'm so sorry that happiness isn't easier to measure. Don't you think we should all be working on that a bit harder? It just feels like the ultimate measure that we should all understand it thoroughly, but maybe that's the last enigma that we all have to sort of sort out. Lorraine, thank you for getting back. I'm sorry you're having so many problems. We've been talking about leadership and funding. We haven't got long, but I just wondered, you're sitting now with a government who's announced €1 million a day for walking and cycling. You seem to finally have got the leadership that the whole world has been waiting for. You've got the money, you've got the leadership. Is it all plain sailing from here, or what's going to be the problems after you've got the money and you've got the people?
So spending it. So it's amazing the investment that's being made. And I think the key challenge at the moment is that, like, we have top-down leadership, we have bottom-up advocacy, but it's actually within our local authorities, having the staff, number one, the staff there to administer the funds, but also the knowledge base on how best to spend that money. there's a bit of a gap there at the moment between the current knowledge within the departments and the people in there and what we're needed. And you know, it's almost like a global shout out, like, you know, there's a shortage of people in Ireland to fulfill these roles, because you know, during
don't start nicking people. We can't start taking people away. We need all these people to be active where they are, where they live. But I appreciate you want people to come and help in Ireland. Yeah.
Oh yeah, I know. Yeah, we're selling
Look,
passports.
we're almost out of time, but thank you so much, everybody, for that. We didn't get to scale, but I think we got a really good flavour of the fact that all of these things, when you get these things right, you know, the journey never stops. We've heard about continuous learning. I think we've heard also about how people have to stay very agile and reactive to change, and so, you know, as we heard from Luisa, changing the metrics when necessary, from Vicki, hiding things if you have to, and creating new launch moments if that's what's required, you know, not to be afraid of those. And Lorraine, you know, to sort of suggest that, you know, just because you've got the money and the political leadership there and the community already engaged and bottom up, top down, it doesn't mean your job's over. So look, thank you very much, all of you, for sharing those insights, for sharing the detail of your presentation. I thought they were all absolutely excellent. I really, really enjoyed them. Thank you for your time today. I'm going to hand back to Daniel, because we're not allowed to continue, much as I'd love to, for another half hour at least. Daniel, how did we get on?
Well, this was amazing. Just to echo our thanks to all three of you. It was fantastic, very enriching, very thought-provoking. I'm sure that everyone attending enjoyed it as much as we did. This is just the second of a longer series of webinars. So before we part ways, we wanted to share with you the schedule for the next session. So the next one is going to be on the 28th of October, which is going to focus on participative solutions in urban transport planning. Then November 11, 25, and then we'll have a final one on the 9th of December. You can find more details at the bottom of our in the Interlink website. And just to say again that this is just the starting point. I think new ideas have come out of this conversation, new partnerships, new friendships, hopefully, and more interest, more shared interest and awareness about our shared interest and our shared mission of making transport more inclusive. With that, again, just on behalf of Interlink and Walk 21, the DPO, and all our organizations involved in the webinar series, thank you again for joining us, and we hope we can see you again in the next session. And with that, I think we're going to close. Thank you all.
Thank you.